Each year, there are more than 100,000 people that die from lung cancer. This unfortunate statistic is so high because oftentimes people are diagnosed at stage 4 because they don't show any symptoms. Cancer in general has 4 stages. Stage 1 is the least harmful to stage 4, which is the most harmful. Lung cancer has many precursors, such as genetic and environmental risk factors, but there are also many treatments that can help put the cancer into remission.
Cancer is the general name for a group of more than 100 diseases in which cells in a part of the body begin to grow out of control. Untreated cancers can cause serious illness and even death.
Lung cancer can be broadly classified into 2 main types based on the cancer's appearance under a microscope: non-small cell lung cancer and small cell lung cancer. Non-small cell lung cancer accounts for 80% of the lung cancers, while small cell lung cancer accounts for the remaining 20%.
Non-small cell lung cancer can be further divided into 4 different types. Adenocarcinoma, as the most common type of lung cancer in women and in non-smokers. Adenocarcinoma forms in the mucus-producing glands of the lungs. Squamous cell carcinoma, the most common type of non-small cell lung cancer and the most common type of lung cancer found in men. It forms in the lining of the bronchial tubes. Bronchoalveolar carcinoma. It is very rare and forms near the lungs' air sacs. Large cell undifferentiated carcinoma. A rapidly growing cancer. It forms near the edges of the lungs.
Lung cancer mainly occurs in older people. About 2 out of 3 people diagnosed with lung cancer are 65 or older. Fewer than 2% of all cases are found in people younger than 45. The average age at the time of diagnosis is 71.
Risk factors for lung cancer include the following: smoking cigarettes, pipes, or cigars now or in the past, being exposed to secondhand smoke, being treated with radiation therapy to the breast or chest, being exposed to asbestos, radon, chromium, nickel, arsenic, soot, or tar, living where there is air pollution.
The main treatment options for people with non-small cell lung cancer may include surgery, radiation therapy, other local treatments, chemotherapy, and targeted therapy.
This disease has personally affected my family when my grandmother was diagnosed in August with stage 4 lung cancer. What type of lung cancer were you diagnosed with, and what was the stage of your diagnosis, and how did they find it?
I was diagnosed with adenocarcinoma of stage 4, which meant that it spread to other parts of my body. And it was discovered accidentally when I had a physical, and I had an x-ray of my kidney because I had a little blood in my urine. The kidney was fine, but there was a piece of my lung got in the in the CT, and that showed that there was something there.
Did you have any predispositions for this disease?
No, I smoked very slightly when I was a teenager, and that was a long time ago, and otherwise I'm a pretty healthy person.
What treatments did your doctor suggest, and did you have any side effects from your treatments?
I was sent to a lung specialist in Maryland, and he suggested I have some radiation, which I did. And then the cancer person here suggested that I have chemotherapy, and I had 6 chemotherapy treatments, and I really had very few side effects. They give you some medication so you won't have side effects.
How did you and your family take the news?
Well, I think we were all shocked by it, and it's sort of like a nightmare. When you have a nightmare, you wake up and it's gone, and in this case it's real, it's not gone, and we're all very upset about this and hoping for the best, because as the disease goes on, maybe it'll be in remission for a long time, and if symptoms appear, they treat it. So hopefully she'll be around for a long time and feeling good.
For more information, please visit www.cancer.org.